Hello, and welcome to this short video on motor development and the importance of positioning for children with Down syndrome. Thanks so much for joining us. My name is Tessa, and I'm a student occupational therapist here at the Down Syndrome Resource Foundation. In this presentation, we will cover what gross and fine motor skills are and how they develop, some special considerations for kids with Down syndrome, how to use proper body positioning to optimize stability and strength, strategies and interventions that occupational therapists use to support independent skills, and strategies for building core strength and fine motor skills in kids. Motor skills in general refers to our ability to move our bodies and manipulate objects. We can further break this down into gross motor and fine motor. Gross motor encompasses the development and skill of large muscle groups in our bodies that control our head, torso, arms, and legs, and involve larger movements such as sitting, walking, jumping, and balancing. These skills begin to develop first, before fine motor skills. Fine motor is the development and skill of the smaller muscles in our fingers and toes that enable us to coordinate smaller, more precise actions, such as grasping a toy, writing with a pencil, and using a spoon to feed ourselves. These skills develop after gross motor skills. There are also two principles that govern development within gross and fine motor skills. The first principle is cephalocaudal, or head to toe. This explains that development begins in the upper part of the body at the head and works downwards to the feet and toes. This is why typical developments use motor control and muscle strength of the arms first, such as clapping or shaking toys, before the motor development of the legs, such as walking or jumping. The second is proximal distal, or near to far. Development of motor skills begins near to the midline of the body at the trunk, and then proceeds outwards to the extremities. Using the upper limbs as an example, the shoulders would develop first, followed by the upper arms, followed by the forearms, and ending in the hands and fingers. This helps to explain, in part, why gross motor skills develop before fine motor skills. Because the large muscles of the shoulder and upper arm, like the deltoids, biceps, and triceps, develop before the smaller, more precise muscles in our hands and fingers. Understanding these two principles can help us to understand some of the motor patterns we may see in our children, as well as manage our expectations and our activities appropriately. There are a number of factors influencing gross motor development in children with Down syndrome, which should be taken into consideration in order to maximize their independence and function. Children with Down syndrome have several physical characteristics that affect how they move and their ability to learn motor skills. The first is hypotonia, which means low muscle tone. This is different than muscle strength. Muscle tone is the tension in our muscles when they are relaxed, and is actually controlled by the brain. This is usually the most noticeable in children with Down syndrome when they are infants. When you pick up a baby with Down syndrome, it's common to describe them as feeling floppy in the neck, trunk, arms, or legs. This is caused by the reduced muscle tone. Hypotonia in certain area affects the development of motor skills that require those muscle groups. For example, hypotonia in the arms makes it more difficult to learn to crawl. Children with Down syndrome also experience hypermobility, or increased flexibility. This is caused by lax ligaments that hold the bones together, resulting in them being more slack or easily stretched, and allowing excess movement at the joints and reducing joint stability. While we cannot lessen the laxity, we can teach targeted gross motor skills, positioning, and strategies to compensate for decreased joint stability and prevent further stretching of the ligaments. Children with Down syndrome also have decreased muscle strength. This is defined as the force exerted to overcome resistance, such as being able to use our arm strength to lift something to our mouths, or push up from lying to sitting. While naturally low in children with Down syndrome, muscle strength can be improved with repetition and practice of desired movements. Therapy will focus on developing strength in the correct movement pattern to prevent your child developing habits that compensate for decreased strength, but may cause improper mechanics in the long term. Children with Down syndrome have also been found to have relatively short arms and legs in comparison to the length of their trunks, so not just in the context of short stature. This makes it more difficult to learn certain gross motor skills, such as sitting, if a baby cannot use their hands to support themselves on the floor without bending their trunk too far forward and losing their balance. Similarly, relatively short legs can make it more difficult to learn to climb stairs or walk up and down street curbs. While waiting for increased growth may be necessary for some challenges, developing these gross motor skills can be supported by proportional sized equipment, such as toddler-sized stairs and stools. Finally, children with Down syndrome are also at increased risk for certain medical conditions that can affect their ability to learn and practice motor skills, such as heart defects, sleep apnea, intestinal problems, ear or respiratory infections, and more. These medical conditions need to be managed effectively in order for your child to optimize their strength, energy, and ability to engage in the practice of gross motor skills. While these are common factors for children with Down syndrome, it is important to remember that each child is unique and will vary in the degree and presentation of each of these factors, which is why you and your support team will work together to make sure that therapy is tailored to your individual child. So, now that we have covered specific factors affecting gross motor development in kids with Down syndrome, let's continue on to the factors affecting fine motor development. Most of these factors are the same as the factors affecting gross motor, but the way that they affect fine motor development is unique. Therefore, specifically looking at gross versus fine motor can more effectively inform how we can support the development of motor skills in kids with Down syndrome. As with gross motor, low muscle tone also affects fine motor development. Kids with Down syndrome may have hypotonia in any and all muscles of the body, including the fingers and hands, torso, arms, and legs. Not only can this low muscle tone affect their ability to use the small muscles in the hands and fingers needed for fine motor skills, but impacts on gross motor abilities also cascade to fine motor skills. If a child with Down syndrome is having difficulty sitting upright and maintaining their balance due to low muscle tone in the trunk, they will be less able to reach out to pick up and engage with toys without falling over, thus affecting their development of grasp and the fine motor skills of the hands. While research does suggest that hypotonia in kids with Down syndrome improves with age, it's also important to intervene early to prevent forming compensatory habits that are a hindrance to the subsequent stages of motor development. Hypermobility caused by lax ligaments can particularly affect the hands of children with Down syndrome, especially young children. Excess range of movement at the thumb joint makes it harder for the child to hold and manipulate smaller objects, such as toys, and subsequently impacts progression through the continuing fine motor development stages. Relatively shorter limbs also has an impact on both gross and fine motor development. Short arms can make it more challenging to learn to sit, and just as with the low muscle tone example, this can reduce the child's ability to free their hands to play with and manipulate objects while they're sitting. Because your child also may have a little bit further to reach, tasks completed away from the body, such as bending down to tie our shoes, can be more challenging for their balance. Additionally, relatively short fingers and small, broad hands common in kids with Down syndrome can make it more difficult to learn fine motor skills. Short fingers and small hands can make it harder to grasp larger objects, so toys and other tools like utensils and crayons should be carefully selected to be an appropriate size. Activities that require larger finger span, such as typing on a regular keyboard or playing the piano, may also be more difficult and require modified hand positioning or modified equipment. In addition to small hands and short fingers, there are other unique physical characteristics that are seen in the hands of children with Down syndrome. At birth, some of these children have not developed all of the small bones in the wrist, known as the carpal bones. These usually develop by adolescence. However, this may make it more difficult for babies and young children with Down syndrome to stabilize their wrists, and therefore control their hand movements as they are developing their fine motor grasp. Medical conditions can affect a child's energy and thus their tolerance and endurance for learning motor activity, both gross and fine. Children with Down syndrome are also at a greater risk for vision problems. These vision problems can affect hand-eye coordination, making it more difficult for the eyes and hands to work together to complete fine motor tasks. It is therefore important for children with Down syndrome to have their vision checked regularly. Finally, fine motor development is also impacted by the cognitive abilities of kids with Down syndrome. Fine motor and cognitive skills are actually closely related during the early stages of childhood development, as much of early cognitive learning develops through manipulating objects in the child's environment. For example, through fine motor skills, a baby learns that if they drop an object, it falls down, or that if they hide a toy under a blanket, the toy is still there when they lift the blanket. Fine motor skills also allow children to develop their understanding of concepts through drawing and printing as they go through school. Especially for children with limited verbal communication, fine motor challenges can further impede ability to express their knowledge and understanding. On the other hand, cognitive level also directs the way that children use their hands. For instance, a child with Down syndrome may have the physical ability to manipulate toys. However, they may not be at the developmental level of understanding how to functionally play with toys and initiate the play activities independently. Cognitive level is therefore a unique factor in fine motor development because the relationship goes both ways. Delays in cognitive ability can affect a child's acquisition of fine motor skills, but delays in fine motor abilities also affect a child's cognitive development and understanding of the world around them. So, with all that being said, there are ways that we can address these factors and support the development of gross and fine motor skills in children with Down syndrome. One of the most important tools that we can use and support is proper body positioning. Body position can, in particular, be crucial for children with Down syndrome to succeed at fine motor skills. As we've seen over the last few slides, gross motor skills and fine motor skills are integrally connected. Oftentimes, what is impeding the development of fine motor skills is poor gross motor development. To refer back to our familiar example, weak core strength can affect sitting ability and balance, which in turn affects a child's ability to use their hands effectively to manipulate objects, such as a pencil, as well as impacting their ability to focus and how quickly they fatigue. While therapeutic interventions to improve gross motor development, such as core strength, are certainly important, occupational therapists also employ positioning strategies to compensate for delayed gross motor abilities and promote appropriate fine motor skill activities while these gross motor skills are still developing. In this example, we can use environmental supports and proper positioning to stabilize the trunk and core in order to free up the hands and preserve energy in the absence of sufficient core strength alone. Proper positioning can also support feeding activities. Breathing is our body's number one priority. Postural stability, so making sure we're not about to fall over, is second. And eating is only number 3. So if kids are not able to breathe properly and do not feel stable and secure in their body positioning, then they are not able to appropriately focus their attention and energy on eating. Instead of being able to focus on chewing and swallowing, an unstable child will be forced to focus on their core stability and trying not to topple over. Proper positioning at mealtimes can promote feeding by supporting a child's ability to breathe, by reducing the physical demands and creating adequate space for their diaphragm expansion. Stable posture also helps the child to feel more secure, so they can better attend to the task at hand, and it also frees up their hands to self-feed. Toileting is another activity that can be supported by positioning. Balance and stability affects a child's comfort on a toilet. Using a smaller, appropriate-sized potty or having something to support their feet on and something to hold on to with their hands when they're on a toilet can promote stability and a feeling of security, which stimulates the parasympathetic nervous system and allows voiding of the bladder and bowels. Sometimes, adapting the environment to support proper positioning is all that is needed for a child to be able to successfully complete a task. Finally, posture and body positioning also play a role in communication and speech development. A child's earliest form of communication is typically gestural, such as an infant reaching their arms out to be picked up, or pointing at or grasping something in an effort to communicate what it is they want. If a child is unable to free their arms due to poor balance and stability in the trunk, their ability for communication is impacted. Our ability to produce sound and develop speech also relies on the coordination of our breathing. A stable core and upright trunk position supports the diaphragm to be able to take deep enough breaths in and out to produce sounds. In summary, a child's posture and body positioning is important for their tolerance, endurance, and attention during seated activities. Proper body positioning when seated includes: the feet are supported and flat on the floor. If the child's feet are unable to reach the floor when seated, a stool or box can be placed under their feet to bring the floor up to them. This is especially important to check for due to the relatively short legs of children with Down syndrome, as standard chair heights may not allow for contact through the feet. Our nervous system is wired to seek contact from the ground in order to tell us where our body is in space. This is also known as proprioceptive sensory feedback. Creating stable contact through the feet allows for the child to ground themselves, stabilize their body positioning, and more effectively engage their core muscles, as well as minimize distracting behaviors such as swinging and kicking the legs. For young kids, high chairs with adjustable foot trays can be used to provide foot support. Here is an example of one that we use at DSRF, called the Abby chair. As best as possible, the ankle, knee, and hip joints should be resting at a 90-degree angle, with hips in line with the knees and knees over the ankles. This mid-range is where our muscles are the strongest, and our joints are the most stable, which will maximize the child's balance and tolerance for sitting. Having the knees in line with or slightly above the hips will also help prevent the child from sliding out of their chair. When seated, the child's back should be supported against the chair. If the chair is too deep for the child to have both their knees at a 90-degree angle and their back against the chair, a pillow or other prop can be placed behind them. This stable contact will support the trunk and help prevent fatigue and poor balance that can result from relatively weak core muscles. When seated at a table or a desk, the elbows should be able to rest comfortably on the surface at, again, a 90-degree angle. This allows for support and stabilization through the forearms when completing tasks, and prevents the shoulders from elevating, as they would if the surface was too high, or excessive leaning over, as would happen if the table was too low, both of which could cause fatigue and poor body mechanics. Low muscle tone can cause kids with Down syndrome to fatigue quickly, as more effort is needed to sit upright and stabilize their trunks and shoulders for activities. Using a slanted writing board like the one pictured here can reduce physical demand by bringing the writing surface into a better visual plane and reducing physical demands such as wrist extension and forward bending. The slanted surface helps kids to be able to sit upright, maintain their 90-90-90 posture, and extend their wrist in order to improve their grasp of writing utensils. Finally, the chair should be pushed in close to prevent leaning forward and reaching. This is especially important due to the relatively short arms of children with Down syndrome, as they may have to reach further forward to access the table. Here is an example of a child who had poor positioning when seated at a desk. As you can see on the left side, her feet are dangling, her back is unsupported, her elbows are not at 90 degrees. This improper posture would lead to instability, fatigue, and distraction, thereby affecting her ability to successfully attend to her typing task. To correct her sitting posture, the following strategies were used on the right side. A box or stool has been placed underneath her feet to allow contact through the feet, providing proprioceptive feedback and improving her stability. A booster seat has been used to raise her up to an appropriate height for the table, which allows her elbows to rest at 90 degrees when using the keyboard. This booster seat also has a back support, which supports the muscles of the core to increase stability and reduce fatigue. Because the booster seat raised her height, books have also been used to raise the height of her laptop to remain in her visual field, preventing her from leaning forward and compromising the posture in her neck and trunk. If the task was writing, a slant board could be used for a similar purpose. A common challenge that kids with Down syndrome experience is proper positioning when in circle time at kindergarten and younger primary grades. Without the use of chairs and tables, any strategies that were implemented to support proper sitting posture are often not carried over to sitting on the floor. Children with Down syndrome may have more difficulty sitting on the floor than their peers due to low muscle tone and core strength, making it challenging to sit upright for long periods without trunk support, and relatively short arms, which makes it difficult to prop their hands on the floor in order to stabilize their trunk. Having a firm, stable surface for kids to prop themselves on or lean against can help, such as sitting against a wall or using props such as bolsters or firm cushions. For kids with higher levels of need, including both gross motor abilities and sensory processing differences, more specialized supportive seating can be explored with an occupational therapist. Some supportive seating alternatives for circle time that your occupational therapist might explore includes a how to hug seat or a disco sit, along with others. Teaching children alternative sitting positions for the floor can also promote proper biomechanics and prevent compensatory habits that would hinder gross motor development. For example, kids should be encouraged not to W sit, with the knees close and ankles and feet splayed out. This is a common problem for kids who have insufficient core strength, as this position creates a wider base of support and stability for the trunk, decreasing the demand on the core muscles. Due to their hypermobility, this posture may feel comfortable for kids with Down syndrome. However, it places excess strain on the hips and knees and does not promote strong core development. The W-sit can also make it more difficult to rotate the upper body and reach across the body, which is important for developing a child's ability to use both of their hands for activities. Alternative sitting postures such as cross-legged, with the legs out long in front, or one knee bent can promote better development of core stability and appropriate hip and upper body mobility. It is important to pair compensatory strategies such as positioning and equipment supports with interventions to address the underlying challenges to motor development in order to promote skill development, function, and independence. This includes strategies to improve core strength and gross motor abilities, and strategies for improving grasp strength and fine motor control. As we have already learned, core strength is one of the foundational gross motor skills that supports independent activities. A weak core can result in difficulty maintaining an upright posture and may present as slumping, leaning on one hand while working, or fidgeting. Having sufficient core strength and stability supports the development of fine motor skills such as feeding, toileting, dressing, and printing and other academic activities. This is why, in order to promote independence in daily routines, occupational therapists will incorporate therapeutic activities that target the development of core strength. The core muscles are the muscles that flex, extend, and stabilize our trunks. While, as adults, we may think of core strengthening exercises as sit-ups and planks, for kids it typically looks a lot more like playing. Kids are best able to build strength by participating in unstructured gross motor play that engages the whole body, such as dancing, climbing in a jungle gym, swimming, running, and much more. The more diverse their play is, the more benefits to their core strength and related success in their desired activities. Organized sports such as soccer or martial arts can provide routine, structure, social interactions, and clear expectations that are helpful for some kids. While these sports are beneficial for building core strength and overall gross motor skills, some of the benefits of free play may be lost by engaging in repetitions of very similar movements. This doesn't mean that organized sports can't be a great part of strength building, but a variety of other activities and movements should also be included. For kids with particularly weak core muscles, or those who are not motivated by free play, exercises that specifically target the core muscles can be built into their daily routine or used as fun movement breaks throughout the day or after challenging tasks. Examples of these targeted exercises include superheroes, crab walks, wheelbarrow walks, army crawling, and more. Equipment can also be utilized, such as sitting on a therapy ball while working or using it for exercises. For infants, tummy time is important for building strength in the core muscles of the back and neck. For kids who are also not motivated by these movement breaks, targeted exercises can be subtle tasks, such as asking your child for help picking something up off the floor, carrying in groceries from the car, helping to clean, or opening and closing doors for you. Strategies designed to build fine motor abilities will support independent skills that require the manipulation and control of objects, including feeding, dressing, grooming, academic skills such as printing, typing, drawing, and cutting, and the development of hobbies. For these strategies, we will break them down by ages, as fine motor skills develop through different activities at different developmental stages. In infancy, preliminary fine motor skills are developed through weight bearing on the arms and hands when the baby's on their tummy, and reaching for toys and pointing when they are on their back or seated. Providing supportive sitting positions can help with accurate reaching and promoting development of hand-eye coordination. Toys should be easy to grasp with both hands and can be used to practice passing from hand to hand or to another person. Toys with concepts such as taking things out and putting them back in, cause and effect, and reinforcement can support learning of object permanency and actions having reactions. Finger feeding should be encouraged, and if the infant is ready, introducing a spoon and cup. For young children aged 2 to 4 years, fine motor skills can be developed through toys with parts that come apart, fit back together, and go into slots and spaces, such as puzzles and shape sorters. Holding of small items for your child can encourage them to start developing their pincher grasp using their thumb and their index finger, while blocks and larger pegboard activities can encourage the use of the thumb and fingers together in a tripod grasp, and they also require targeting when placing the items, which can develop precision. During this time, we can introduce markers or crayons and scissors and demonstrate the correct way to hold them, even if your child isn't ready to hold them this way yet. We can also encourage our kids to participate as much as possible in feeding, dressing, grooming, and cleaning. During the years of 5 to 8, we can encourage individual finger movements and actions, such as through songs like Itsy Bitsy Spider. We should encourage our kids to use their tripod grasp when holding writing utensils for drawing, pre-printing, and printing activities. They should be encouraged to be mostly independent with dressing, including doing up fastening such as laces, zippers, and buttons. Toys and activities should provide opportunities to strengthen their pincher grasp and precise targeting, such as piggy banks and clothespins, as well as develop bilateral hand coordination, such as threading beads and building with Legos. Kids this age can also be encouraged to help with fine motor tasks in the kitchen, such as pouring, mixing, and scooping ingredients. Finally, for kids aged 9 to 12, as well as those who are older but still developing their fine motor skills, they can participate in more household chores that require hand control, such as sweeping, folding laundry, and wiping surfaces. Bilateral hand activities that require smaller movements of the fingers and wrists can be introduced, such as folding paper or using sticker books. Individual finger movement activities can be progressed to typing on a keyboard or playing an instrument such as the recorder or piano. Kids should be encouraged to hold eating utensils with a mature grasp and perform actions such as cutting and spreading. Printing or pre-printing activities should be encouraged and can be progressed towards proper grasp as well as appropriate letter formation, size, and spacing. Finally, kids should be encouraged to develop leisure activities that involve fine motor skills and are fun and rewarding for them. This will provide the greatest motivation for practice and use of their fine motor skills. The main takeaways that we hope you gathered from this presentation are that kids with Down syndrome face challenges to developing gross and fine motor skills that may require extra support from their families, their schools, their medical team, and other helping professionals. And that proper positioning and specialized strategies for developing core strength and fine motor abilities can help kids with Down syndrome become more independent and reach their full potential. For more information or for support for your unique child, feel free to contact an occupational therapist at DSRF at the contact information found on this slide. Thanks for watching.